Thank you very much. Good morning, everybody. Let me give my personal thanks to the organizer of this wonderful meeting and also on behalf of the World Association of Bronchology and Interventional Pulmonology that I have the honor to be chair at this moment. Thank you and good work for this meeting. Well, I will repeat something that Lorenzo has already told about. This is my conflict of interest disclosure. Well, you have seen already the definition of interventional pulmonology that is the hardest science of medicine related to performance of diagnostic and therapeutic procedures that require additional training and expertise. So I would like to underline some critical point on this. Question and doubt about education. The first is, to whom should we provide training in interventional pulmonology? The second point is, where to provide training in interventional pulmonology? And another question is, how do we provide additional training and expertise? Well, training in interventional pulmonology is very complex, and it requires a lot of knowledge because the components are theoretical knowledge of pulmonary anatomy, pulmonary pathophysiology, understanding of imaging, basic knowledge of cytology, pulmonary cytology, knowledge of clinical pulmonology, understanding of pharmacological agents, knowledge of different IP technologies, the possibilities and limits of each technology, knowledge of indication, contraindication, and complications of the procedures, and knowledge of the role of IP in diagnostic and therapeutical pathway of chest disease. So a lot of components, but last but not least, development of manual skills. Well, all the pulmonologists can acquire this knowledge. But what about manual skill? Development of manual skill depends on different aspects, on different factors. The practice that is acquisible, but individual natural bent also is an important aspect of manual skill, and the passion, that is an individual attitude. Well, individual natural bent doesn't belong to all the people. Out of 2 guys, even after a life of training, will never become like Bocelli. What does it mean? It means that some people acquire skill very fast. Other people require some more time. But there are excellent pulmonologists. And during my life, I know a lot of excellent pulmonologists that are unable to move their hand and that never will reach the skill necessary to perform bronchoscopy and interventional procedure. Another very important factor is age. To whom should we provide training in interventional pulmonology? Have you seen people playing tennis and people skiing? You immediately recognize people that learn as young to play tennis in comparison to people that start to play tennis at 50, others 60. They can be good tennis player, but the automatic reaction and the fluidity of movement are different and are acquired at a young age. So I think that interventional pulmonology should be mainly trained in young colleague with patient and with a predisposition to manual skill. Where? This is another problem. Training center. This is a problem of Interventional Pulmonology Society, to identify training center. That means centers that have a high volume activity and that are certified in their quality by a scientific society. What are the problems? The problem are that few centers perform all the interventional pulmonology procedure at a level. I know centers that are excellent in diagnostic bronchoscopy, but not in rigid or thoracoscopy. Some centers perform thoracoscopy, but not bronchoscopy. Other centers are excellent in IBUS, but not in rigid. So there is the need to perform fellowship at different centers to complete the educational pathway, and each training center should provide a list of the technique performed at high level in that center. The last question is how to provide additional training and expertise. We today are very lucky. When I start to learn bronchoscopy, I couldn't see anything. I just could ask to my mentor to move his head to allow me to put the eyes into the scope, but it happened for a few seconds. And then my head say, oh, okay, I have to work, go away. Today we have video, literature, books, atlas, CD, internet, hands-on courses, postgraduate master, and fellowship in qualified center, a lot of possibility. What happened in Europe? In Europe, there are several hands-on courses, generally 2-3 days, with theoretical and hands-on, and sometimes there is also the possibility to observe live procedure. There are IBUS courses for bronchoscopy course, for instance, in Athens, Professor Stratacos, thoracoscopy course in Marseille, Professor Stuhl, and there is also a nice, very nice program organized by the European Respiratory Society on IBUS TBNA with courses in Heidelberg. Professor Hert is here, is one of the leaders of this program, and Professor Yukanema in Amsterdam also organize IBUS courses. But all these courses are just 2-3 days. The EBUS, ERS IBUS program requires 3 steps, a first step course, a second step course, and then the participants should record their performance that will be evaluated by expert, but is just on IBUS, this program. Well, Lorenzo told about master, postgraduate masters. To my knowledge, in Europe are just in Italy, and there are 2. One is in Florence, we have already listened about. The other one is in Ancona. What is a master? Postgraduate master is from Latin magister, is an academic degree awarded by university or college upon completion of a course of study demonstrating mastery or high-order overview of a specific field of study or area of professional practice. The Italian experience in this sense is done in Florence and in Ancona. we had experience in Ancona with a lot of hands-on courses. We organized in the last 10 years about 70 editions of courses called Weeks in Interventional Pulmonology, and we had 650 participants from 10 different countries. But again, there were very short courses, 5 days courses. And so we started with the organization of a master. We are younger in comparison to Florence. Florence arrived this year at the 14th edition. We just organized 4 editions of our master. You can see that not only pulmonologists are interested to this training. You can see the percentage of different specialization in Florence and in Ancona. There are also internal medicine. There are also some ear, nose, throat specialists, thoracic surgeons. And one of the criticisms is the mean age. As I told you before, I think that interventional pulmonology training should be done as in young age. And you can see here that the age for both master in the 2019 edition, both for Florence and Ancona, was not very young, more than 40. That means that people that can pay or that can find resources to participate in a long training period probably are colleagues that are already aged. Male and female, more or less the same percentage in both. The master curriculum of Ancona is organized in this way. There are 1,500 hours of teaching, 130 hours of frontal lessons or seminars held by national and international experts, 685 hours of alternative didactic, that means live cases and hands-on, and 685 hours of individual study, literature, books, slides, or the recording of the live cases performance. And the master is completed by 2 weeks of frequency in a qualified high-volume interventional pulmonology service. And of course, there is a final examination and the thesis discussion to finish. You can see here some picture from Florence experience and Ancona experience, frontal lessons, live cases, hands-on, based on low fidelity simulation, low fidelity model simulation, or high fidelity simulation. You can see here training on simulator, both in Florence and in Ancona. And the live cases in Ancona, the master participant observed 50 cases in 2021-2022 of every kind of interventional procedure: diagnostic and therapeutic bronchoscopy, HIBUS, rigid bronchoscopy, bronchoscopic lung volume reduction, thermoplastic, percutaneous needle aspiration, thoracoscopy. You can see here some picture. And also the individual study is another important aspect. There are online platforms both for Florence and Ancona. And the participant can find a slide of the lesson, the main paper concerning the different topics, and the registration of live cases. These are the 10 integrated courses in which our master is divided. You can see that all the aspects of IP are evaluated, but we try to include the interventional pulmonology procedure in the pathway of the different disease. You can see IP and infiltrative diffuse lung disease, IP and lung cancer, pleural pathology, sampling technique, interventional pulmonology and infectious disease. These are all the courses in which the master is divided. And the final evaluation of course questionnaire, evaluation on simulator, and final master thesis. You can see here some of the theses that were performed by the participants. So the master, in my opinion, is an important educational step that can provide the additional training that is required for education in interventional pulmonology. But it's useful also for colleagues that never will become or don't want to become interventional pulmonology, but just pulmonologists. Why? Because the master can provide competence and knowledge on the possibilities of interventional procedure. You can see here what happens in Italy, and I don't know in your country, but I think in many places it happens that pulmonologists, non-interventional pulmonology, look cases like this and send these cases to the surgeons for diagnosis. It happened in Italy, and it should never happen. That means that there are a lot of pulmonologists that don't know what IP technologies can do in terms of diagnosis. But master is also an important educational for people that want to become interventional pulmonologists. For these pulmonologists, but master is not enough. The educational program should continue with long time attendance, that means 6 months, 1 year, in a high volume IP service. This is slides that I thank Lorenzo for giving me. I modified it, and you can see that in this educational pathway, the master is just one step in the middle. But after that, there is the attendance for a long time in a high volume IP service and the practice. But practice is lifelong learning and should endure for all the life. Don't forget that passion is an important, very important element of education. I don't know in other countries, but in Italy, interventional pulmonology doesn't allow to get a lot of money. It's better to work with drugs, with aerosol, with spray for COPD treatment. You can get more money in this way. So the model that should move you to learn interventional pulmonology is passion. This is some picture of the Ancona master and the Florence master, and all these people had passion, and I hope that in the future they will become very, very good interventional pulmonology. Thank you for your attention.